let's talk CIW and CQC, taking it back to the UK.
Yep.
So I guess, one of the key aims of any provider is to get that outstanding inspection. How does MOA help with that? Does working with MOA kind of guarantee that?
Well, I don't think, a system or can ever guarantee something like that. But what it can do is enable a really robust process around continuous improvement. And so, my conversations that I've had with the CQC is they're at that stage where there's a real desire to see, okay, we're doing the work in terms of our assessments and we're auditing, but how are we actually translating that information into an opportunity for improvement, and then how are we actioning that and holding ourselves accountable to what success looks like in that action. And so, that whole process can be managed very cleanly end to end. You can demonstrate where the problem was found, what we plan to do about it, what the outcome looked like in terms of whether or not it was successful, and then evaluate that down the track. And that all happens within the workflow. I think any good system in a sector that is, really challenged for time, it's really important to get the workflow right. And so embedding it in a sensible workflow will be able to help them, put them in good stead and for demonstrating that.
Let's talk about benchmarking.
Sure.
Because you are using data from other providers to help your customer providers benchmark their performance. How does that all work?
Yeah, that's right. So the premise is that in any area, particularly something like, if we talk about falls among older people, that's something that's going to occur. And so the question doesn't become whether or not we're not aiming for zero. We're not aiming for zero pressure. It's just not a realistic goal. And so the question becomes, well, are we seeing more than we expected to see based on services to ours? And so what benchmarking enables, and that's obviously done confidentially between providers, but it allows you to get a picture of not just whether or not you're higher or lower than your own historical performance, but whether or not how you compare across the sector.
So that will give a provider a degree of confidence when they're going into inspection that, we're above the industry kind of benchmark here, so we should be okay.
For something like auditing, obviously you want to be above. For adverse events, something like falls, you want to be below. So yes, it gives you a degree of confidence. The other point I'll make with that benchmarking is we'll flag them relative to some underlying rate, which is our benchmark, but we'll also flag whether or not someone's significantly lower than we expected, because underreporting and lack of information can also be quite problematic.
And are you giving pointers as to what a provider can do if their indicators are suggesting that they're not performing as well as they could?
I think if there's a particular indicator, generally, we'll provide broad recommendations about the kinds of strategies that you put in place, and that exists within both the audits and the quality indicators. Within MOA, we also have an AI assistant to help co-design improvement actions as well.